We are pleased today and we'd like to welcome Dr. Mohammad Alshammari, endodontics specialist, to talk about one of the procedures that patients fear the most, root canal treatment. Many people feel anxious just by hearing the word, but in reality, this treatment is the main solution to save the tooth and protect it from extraction. With modern advancement in dentistry, root canal treatment has become easier, more precise, and far less painful than ever before. Today, Dr. Mohammad will speak with us about its importance, the signs of damage, the latest techniques used in treatment. It's really a pleasure to have you, Dr. Mohammad, in Good Morning Kuwait.
Good morning.
Dr. Mohammad, tell us, what is the main function of the tooth nerve and why is it too important to preserve it?
Well, first of all, the tooth nerve itself, it's not just only the nerve. Okay, there are more than one component.
Okay.
It's the nerve itself, the blood supply, which is composed of the arteries and veins. So all of these together are called the pulp of the tooth.
Okay.
So these components gives the vitality of the tooth. And what I mean by vitality is it gives the tooth the sensation. So when we drink any cold drinks or hot drinks, we feel the sensation. And at the same time, it's the mechanism of defense against any bacteria or any irritation to the tooth itself.
That's definitely something very important. That's why, they say when you lose the nerve of the tooth, it's done.
Yes.
Unless you put a crown for it. So.
Yes, exactly.
So is every toothache related to the nerve, or can there be other reasons? Many people are afraid, of the phrase, root canal treatment. In your opinion, why is it associated with fear among patients?
Well, first of all, is any tooth pain related to the tooth? This is not actually a correct term. Okay, we have an odontogenic pain, which is any pain that is related to the teeth, and we have non-odontogenic pain, which is pain that simulates toothache. For example, in non-odontogenic pain, when we have pain to the muscles of the mastication or the muscle of the TMJ, they sometimes mimic, and the patient feels the pain as the tooth pain, but actually it's not the tooth itself. And sometimes when you have sinusitis, inflammation of the sinus.
The gum, for example.
No, the sinus, which is...
the sinus, near the nose.
Exactly. Because it's the proximity of the sinus to the teeth, it gives the same sensation as the tooth pain. So this is the non-odontogenic pain, while the odontogenic pain is the pain from the tooth itself.
Yeah, that medical term,
yes,
threw me off.
Yes, exactly. I know the medical terms are very difficult, so I'm trying to
pronounce it for me.
Odontogenic pain.
Odontogenic. Okay.
So in tooth pain, when we have the nerve itself is damaged, at the early stages, the pain is slight to cold or hot drinks, and then with the advancement, it becomes pain with biting.
Okay. So. What are the signs that alert the patient that the nerve is damaged and he needs to treat it?
Yeah, it's a dynamic process. Okay, it starts with very minor.
We can see on a monitor now.
Yeah. It starts with the minor signs and symptoms, which are pain with hot and cold, and then it advances with pain on biting, or later on stages an abscess will develop. And the abscess, which I mean, is the pus that comes around the tooth. We either have a swelling, an intraoral swelling, which is inside the mouth, or outside the mouth. The swelling could happen outside the mouth.
So then we know that we need a definite
root canal treatment.
Root canal. And let's talk about the complications of neglecting root canal treatment, and when is the tooth extraction better than root canal treatment, and does root canal treatment mean that the tooth dies and has no function?
Yeah, whenever we are delaying the treatment, what will happen is the tooth will break furthermore. So we have less tooth structure.
Okay.
And what that means is that the tooth is unable to have its function, okay, as the mastication.
Yeah.
So whenever we are neglecting, we are losing more tooth structure, the tooth becomes weaker. So at the end stage, the best treatment option will be extraction and having an implant placed. And whenever we are neglecting the treatment, we will have an abscess. So the abscess is the collection of pus, and the pus will become bigger, which will have more bone loss. So weaker bone. So in the future, we cannot place any implants.
Okay.
So whenever we need a root canal treatment to be done, it must be done as fast as possible.
That's definitely root canal is very important then for in that manner.
Exactly.
Is it safe for all patients or only for specific groups that, you know, when we talk about the modern medical techniques and root canal treatment, recently we have started hearing about the use of general anesthesia and dental treatment. When do we use it instead of local anesthesia? And is it safe for all the patients? And how is the patient prepared for undergoing general anesthesia like that?
Yes.
What are the advantages of general anesthesia and making root canal?
So in recent days, there's a development of the type of anesthesia.
Really?
Okay. So and as more people having more fear toward dental phobia,
so they take full anesthesia.
They take general anesthesia to do all of the treatments, not just root canal treatment, any dental treatment under general anesthesia where they are not fully aware or awake.
Really?
And they don't feel anything.
It's like a surgery taking
Exactly,
place.
exactly. It's just a surgery.
Okay.
What are the advantages? Well, we shorten the length of the treatment.
Okay.
Instead of having multiple visits, multiple times to come to the clinic.
He sleeps.
And he does everything. In implants, extractions, root canal treatment, fillings, cleaning of the teeth, all of this in just one session.
The doctors will rotate on him.
Yes, exactly.
Root canal specialist
Exactly.
finishes, then the crown guy comes in.
Yes, exactly. All of this done under general anesthesia. Regarding it's safe, yes, it is completely safe. Why it is safe? Because before you are doing the general anesthesia, you will have multiple steps to be done. You are going to take a CBC, full blood count, checking the general health.
So basically checking your blood and, you know, all, you know, the heart enzymes and stuff like that.
Exactly. You are going to take a full checkup on your health. And even when you have any health problems, it's always under control, because there is multiple doctors, multiple physicians and anesthesiologists that are going to take care of you. There are some contraindications, for example, people with pulmonary disorder or any lung diseases that cannot undergo general anesthesia, but they are very rare. In general, it's very safe because you are monitored during the whole procedure, and also it is less painful actually. I have done it more than, let's say, hundreds of patients. Really? Yeah, nearly 99% of them, they all said that it is actually less painful. Why? Because they take the drugs through the IV. Yeah. So it's have immediate effect of analgesia. Yeah. So they don't feel anything actually, even after the surgery.
Okay, never mind, doctor. This is really, I agree, but I mean, for how long?
The surgery?
No, the anesthesia.
Yeah, it's like, let's say, the maximum is 4 hours.
4 hours?
Yeah, maximum.
Okay, and
this is a very extensive surgery. This is a very extensive dental treatment.
We're talking about all kinds of operations.
Everything done, like extraction, all of the wisdoms, doing implants, doing root canal treatment. The maximum could be done under 4 hours.
4 hours.
Yeah.
And
sometimes it takes only 45 minutes or 1 hour.
Okay, when you say he's laid down, is he laid down like slope, 45 degree, or
slightly
straight?
tilted? Slightly tilted. Yeah, slightly tilted.
Yeah, but then he will wake up after 4 hours.
Yeah.
Done.
Done. Finish. 2 hours. He stays in the ward, and then he goes back to home.
Do you think people like this better?
Actually, I have seen many people that want to do this, but I'm trying to convince them that they don't need it. They should do it under the dental chair.
Yeah.
But I have seen a lot of patients, like recently that day in my clinic, where a patient came to me and she wants to do the treatment under general anesthesia. And I was trying to convince her to do it under the dental chair, but she wants to shorten the treatment time.
Yeah, yeah.
She doesn't want to come every day to the clinic.
Yeah.
Because as you know, under local anesthesia, the anesthesia wears off in a short period of time.
That's
so I must
true.
be very quick, and I cannot give a lot of amounts. I'm in healthy patients, I only can give 11 carpals or 11 injections. That's the maximum that I can give, which is rarely I do it. I only give 3 to 4 injections. But so I have very short time to do a very like 1 or 2 treatments. That's it. I cannot do furthermore. So if the patient have an extensive treatment plan, then he must come at least 6, 7, 8 times. So most of the patients, they want to shorten that treatment into 1 visit.
So why you guys ask always, do you smoke?
Yeah.
Do you drink forbidden drinks?
Yes.
Why is this question?
Yeah, this is a very good question. Well, because smoking and drinking any forbidden substance or any habit, okay, have an effect on healing. So me, for example, if I'm going to place an implant, I will have a prediction if this implant will have less success or more success.
Okay.
For example, if you are a smoker, I will know that the implant will have more chance of failure, okay, because we have less healing. Why we have less healing? Well, when you are smoking, we have less blood supply to that area.
Okay, I
see.
see.
So there is no any blood that's coming to this area to help with the healing. So that's why we have less healing and more pain with any procedure.
Okay.
For example, if you are diabetic, the same thing happens.
Pregnant woman?
No, pregnancy is another thing. Actually, pregnancy, it's
for
very
anesthesia. Is it?
Well, in pregnancy, I will divide them into 2 categories. Okay, emergency treatment, and what I mean by emergency treatment is that the patient or the pregnant woman have a severe pain that she needs to do an immediate treatment. And taking any medication, for example, antibiotics or analgesia, will harm the baby. So she must do the treatment now. This is safe during any time of pregnancy. Actually, all of our material, the local anesthesia or our treatment, is very safe for any pregnant woman. But any elective treatment, which is treatment that is not emergency, this can be done during the 2nd trimester, which is the 4th, 5th, and 6th month of pregnancy.
Okay, I see. That's definitely something has to be considered,
Yes.
Yeah. So how long does the effect of anesthesia last after the session? You said 4 hours?
Yeah, it could maximum 4 hours. Yeah.
And do we expect general anesthesia to become common in dentistry in the coming years?
Well, I'm seeing the trend is rising. Okay, and maybe I would say I'm one of the few in Kuwait that does this type of treatment.
Dr. Mohammed, I don't know. I have a feeling, instead of having this big general anesthesia, the local is better because you can give a sense and communicate with the doctor.
Exactly.
Are you in pain? Is this okay? Do you feel, I mean, these...
But the type of patients that I see, are patients that have severe dental phobia. They don't want to sit on the chair.
Yeah,
okay.
once they see the needle. And
Yeah, and patient with disabilities that cannot communicate. So patients that have a very severe treatment, very big treatment plan that cannot be done only under general anesthesia.
So, what is, just last question because we are out of time, Dr. Mohammed, what are the most important tips after root canal treatment to keep tooth healthy?
Well, the first important thing to do is having a crown placed after the root canal treatment. Why is that important? Because already we have lost a lot of tooth structure. Already the tooth is weakened.
So try to...
So we try to place a crown to protect the tooth. For example, when you're buying a new iPhone, okay, or any phone, so what you're going to do is place a cover to protect from breaking. So imagine doing a root canal treatment, paying money or taking this length of treatment, and then you break the tooth.
Dr. Mohammad Alshammari, it was really a pleasure, and thanks for enlightening us and our viewers.
Thank you. Thank you.
Dear viewers, in conclusion, we would like to extend our sincere thanks and appreciation to Dr. Mohammad Alshammari for being with us today and for the valuable medical information he shared with us, such clarity and simplicity. Today, we learned that root canal treatment is not something to fear, but rather an important step to save the tooth and protect it from extraction. We also understood that modern techniques and anesthesia have made this procedure much easier and more comfortable for patients. It's really a pleasure for our host. Thank you very much, Dr. Mohammed. And next, the viewers will move on for the museum as a window into time, a place that stops us at milestones of a long history, allowing us to relive the details that connect past and present. Each piece within it carries a memory and tells the story of people who once lived and left their mark for generations to come. Tariq Museum is a true journey into heritage and art, from ancient tools to rare treasures to collections that form a vivid portrait of our history and identity. Let's take a watch. Let's watch this report, and we'll be back.